Good evening, everyone. We'd like to call to order the meeting of the Community Mental Health Board on Wednesday, January 22, and I'll begin by reading our mission statement. Macomb County Community Mental Health, guided by the values, strengths, and informed choices of the people we serve, provides quality services which promote recovery, community participation, self-sufficiency, and independence. Next is adoption of the agenda.
Support.
Motion by Plua. Oh, Nick. Sear material and supported by O'Connell. Any questions on the agenda? All in favor signify by saying aye.
Aye.
Opposed? Motion carries. Agenda is approved. Next is item number 4, hearing of the public. Is there anyone from the public that would like to address this body? Anyone from the public? You have 5 minutes. Okay, seeing none, then we will move on to item number 5, and that's approval of the minutes of the regular board meeting that was held on December 18, 2019. Motion by Selena, support by Lori. Any discussion on the minutes? All in favor signify by saying aye.
Aye.
Opposed? Minutes are approved. Next are the minutes of the program and budget meeting that was held on January 8.
Move to approve.
Motion by Kraft, support by Plua. Any discussion on those minutes? All in favor signify by saying aye.
Aye.
Opposed? Those minutes are approved. And then next is item number 7, which is a request to approve 2 different items. One is the cost of the survey for the CARF accreditation. Other is request to approve the fiscal year 2020 PIHP contract amendment 2. And both of these items were discussed in full at the program and budget meeting.
Move to approve 7A and B.
Support.
Motion by Sear Materials, support by Nagovan. Any questions? All in favor signify by saying aye.
Aye.
Opposed? Motion carries. Next is receive and file. Are there any items, was there anything turned over to us that we needed to see? Oh, we could do, yes, there is. This yellow, the goldenrod page on your desk is the list of meetings for 2020 and also for January of 2021. The very first item says program and budget on February 5. That needs to be changed to February 12. And so the item, that February program and budget is February 12. And everything else appears to be okay. If they're not held on the 2nd and 4th Wednesdays of the month, it's because there's some type of holiday that month, so they're making up for that. So we need a motion to receive and file this
So moved.
committee calendar. Motion by Fantuzzi, support by Schmidt. Any questions on the calendar? All in favor signify by saying aye.
Aye.
Motion carries. Calendar is approved. And next, item number 9, as of the agenda time, there were no resolutions. Have any been added? No resolutions, okay? Then we have probably one of the most important things we do, besides approving contracts, is vouchers, paying the list of bills.
I'll move to pay the bill.
All right. Motion by Phillips,
Support.
support by Plua. Any discussion on that? All in favor signify by saying aye.
Aye.
Opposed? Motion carries. Next is the management report.
Been on such a roll going through everything so quickly. I think I'll start with the good news and then kind of go on from there. In the audience this evening is Helen Klingert, who is now our new Director of Substance Use Services. Congratulations, Helen. Did you want to say anything? Randy used to always come up to the microphone.
Well, I'd just like to say thank you. I'm very excited for this position. I've been with community mental health for over 16 years, and I really love what we do and the work that we do. So there's a lot of great opportunities coming forward, and I really just look forward to taking them all on. And I know one thing Randy does each year, and I didn't ask him if he did it because I don't know if he came in January, but he brings recovery calendars. So I do have those here for anybody who'd like them. I'll just leave them at the table.
Some of
Great.
us told the truth, but you were actually doing all the work.
There it is.
You just moved into the job you've been doing all along.
Well, thank you,
It's
yeah.
already in.
I'll let him know. He'll
And
appreciate that.
Did he tell you about the chocolate?
No.
Oh,
Cake?
Oh, no. Is there secrets I don't know? Did it come empty-handed?
You're
you.
good.
Thank you.
Thank you, Helen. That concludes the good news portion.
Wow, that was fast.
Yeah, I know, and
You
fleeting.
had LinkedIn to bring somebody else to help you with it.
We can keep, Helen, you can keep talking, or, on the financial side, for our revenue, it continues to be a mess. So they changed our funding model. Basically, the Milliman funding model is still there, but the factors that go into the model were changed for this fiscal year. So they made mistakes in October, and the revenue statewide was wrong. So we got Milliman information ahead of time to help us make projections, but then what we actually received was way off from that. The state said, well, we'll fix that in November. Didn't happen, and they actually found more problems. It's primarily specific to folks in My Health Link, which impact Macomb County more than some of the other regions, and the Habilitation Supports Waiver funding, which we have quite a few of as well. So revenue's been all over the board. It was wrong in December. Now they're saying everything should be netted out in January, which makes our first true revenue payment in February, 5 months into our current fiscal year. That's kind of difficult. And then in January, they started withholding the Medicaid money for the deceased beneficiaries from 6 years ago. That's just kind of the cherry on top. So we're trying to end this current fiscal year, wrap things up, and the state then lets us know that there's 2.1 million is Macomb County's portion. I believe it was $43.8 million statewide, but that included physical health, Medicaid payments, and the behavioral health Medicaid payments, and our portion is a little over $2 million. And then to make it even more fun, they're taking it out, the $2.1 million over a 12-month period of time, so it'll cross into another fiscal year. But they're not taking it as 1/12. They're taking it based on the month that the person passed away. So each month will be a different amount and make it that much more challenging for us to track. Also at the state level, I was in Lansing today. We're supposed to have an actuarially sound funding model. Well, our funding for the last 6 years has been based on the money we receive for those deceased beneficiaries. So, but the state has yet to address that in any way, shape, or form. So it looks like we'll end last fiscal year on a good note. But then going into this one, the current revenue is pretty messed up. I did talk to Richard Carpenter yesterday. He found some free time and he had done some calculations, and I'll be able to share a revenue projection for the current fiscal year with you soon. Before the next meeting, I'll email it out. And he did there was in 2018, the state did an exercise, and they did some readjustments due to deceased Medicaid beneficiaries in 2018. Our concern was they were double dipping, that they had counted the same person twice in 2018 and current, but it looks like it's a pretty accurate count. So we're dealing with all of that on the revenue side. Yesterday, late yesterday, I got an email from Alan Bolter. It's passed the House and the Senate now. There's a supplemental revenue bill for 2019, for fiscal year 19, which gives Macomb County $2.5 million. Bad news with that is it's because we hit the risk reserve for last fiscal year. Apparently it was Oakland County, Lakeshore, Macomb, and one other PIHP that hit the risk reserve. Problem is we didn't hit the risk reserve because we underreported our Medicaid revenue. But the state knows we underreported the Medicaid revenue because they're the ones who pointed it out to us. So the legislators are over here passing to give us $2.5 million, which my fear is we might have to give back because we did not. This is kind of hot off the presses. I will continue to follow up on that. If not, we did have, there's some other ways we could spend that. We did have a compliance issue which hit our Medicaid funds. But I'll give you a more detailed financial update when I have all of that information. So last fiscal year, kind of some bumps in the road, but we should end on a positive note. Current fiscal year, we're doing okay, but the revenue files are statewide have been wrong since October. So we're trying to manage our way through that as best as possible. Nick?
Just a few quick questions. The supplemental appropriation was, I didn't see it. Can you tell me how much it was statewide and how it was to be distributed? Was it specifically tied to the risk reserves?
It's House Bill 4245.
4245.
The Senate passed it Tuesday morning, so it's on the way to the governor. And I'm going to skim quickly here. It went through appropriations. It would be to provide appropriations for fiscal year 18-19 for the Department of Health and Human Services. Would provide funding to cover expected expenditures and to square appropriations with expenditures for book closing.
That's okay, David. I'll read the bill.
I can forward the email.
I've got it. That's okay.
Okay.
And I know how to access it real easy. On the deceased adjustment,
Yeah.
the last time we talked, you and I think the other PIHP directors were discussing the legal ramifications. Is there any update on that?
We continue to have discussions. In most of the PIHP regions, the dollar amount was pretty small. Wayne County was approximately 10 million. I believe Oakland was 5 or 6, and we were a little over 2. So it's definitely hit the Tri-County area hardest. I met with Jeff Chang from PCE because we were looking to do that data drill down about, they gave us a file of the deceased beneficiaries, Then we had to go back 6 years and look for Medicaid months that were funded, and he was going to help us do that. But we made some headway, according to Richard yesterday. So it does.
Have you referred the deceased payments to corporate counsel?
Not yet, no.
I'd suggest you do that. On the money we're off for this fiscal year, how much and which way, and do you know?
It's supposed to be all netted out in this month, and then our clean revenue file minus the deceased beneficiary payment. The first one would be in February.
Understand. But do you know as of, for the 4 months where you've actually received dollars, what we should have received as opposed to what we did receive and what the difference is?
Not in detail to share. I can get that to you in a few days.
Okay, thank you.
I know our revenue files were about 15 million for October, November. December, it went up to 18.7. I haven't seen the adjustments for January yet.
I haven't, if you could just explain the deceased, who's responsible for reporting that?
That's completely on the state of Michigan. Because it's Medicaid eligibles in Macomb County, those people don't ever have to have touched our system at all. So it's only available at the state level. And it was the federal government that caught the error. So now the department's scrambling to correct it.
Okay, thank you.
In your packet, you have termination letters for, one is a provider at the complete provider, and the other two are provider sites. All three were triggered under the, our contracts have a 60-day out for no cause. So we triggered that in each of the cases. For the two sites, we are moving quickly to relocate the people temporarily due to some significant health and safety concerns that we have within those homes. So I'm happy to answer any questions, but please know there was sufficient, significant. I'll leave it to health and safety concerns because we triggered the 60-day no cause. While I'm on contracts, thank you for approving our contract amendment on the PIHP side. It hit me while I was sitting there in Lansing today. Our CMHSP contracts are now going through the state's lovely, very user-friendly eGram system, and that was sarcasm. So I have to sign them electronically, which does not leave space for the Office of the County Executive to confirm those. So I'm going to have to work out some sort of arrangement with the county exec's office and or the state of Michigan. That's one update, terminations. The supplemental, the deceased. At the federal level, they have expanded, and actually they've put twice as much money into the CCBHCs. That's the fun acronym. That's a Certified Community Behavioral Health Center. If you're familiar with the FQHCs, the Federally Qualified Health Centers, this is their counterpart on the behavioral health side. An FQHC is for physical health. The MyCare clinic that shares space with us at the First North is an example of an FQHC. It's part of Senator Debbie Stabenow's Excellence in Mental Health Care Act, and there is an expansion in Michigan. Macomb County, under John Kinch and Jim Losey, did pursue this previously, but then I think it ended up not being submitted. I received a inquiry from the department asking if we would, they went out to everybody who had done the preparation but had not submitted and inquired about our interest. I said yes, Macomb was still interested. Didn't hear anything, and now the feds have approved it, it's out, and we have to respond by March the 10th. We're meeting internally. Jim Losey has provided us the prior submission, and the submission requirements have changed. A lot of it, they don't want too much paper. So our initial introduction was over 100 pages. Now they're limiting it to 10. So we'll be going through and updating that. It's a $2 million grant. It is competitive, and it will be a challenge, but it moves us in the right direction.
Can you submit it on longer paper?
Yeah, they don't want too much because they're going to get a lot of applicants. We attended the Metro Region dinner. Dr. O'Connell was there, Tony was there. Some of the staff and myself attended. Bob Sheehan from the association gave a really nice update on the state's SIP, the strategic integrated plans, and where the department is and some of the issues and concerns with that. I'm working on a summary to go out to everybody, but it gets really complicated after the opening sentence. If there's enough interest, we could have a study session on that, but I'll give you the information. And I have shared some of the handouts and stuff from that, from Bob, Director Gordon's first presentation. There hasn't been a lot of changes since then. They have been doing the public forums. They asked for a meeting with Wayne, Oakland, and Macomb. So it was a 1-hour meeting, and I was kind of surprised. They called the meeting, they scheduled it, there was no agenda ahead of time, and when Sarah kicked off the meeting, she said, well, there's no agenda, we just kind of want to hear from you. Do you have any questions? And she threw it right back at us, and I thought they might make some sort of a announcement or say, we want to talk to the three of you for these reasons. They were just listening. I got most of my questions out on the table. Willie kicked us off and went for about 45 minutes into the hour. Then I jumped in, and Anya from Oakland wasn't able to get her, but she did participate. I'll summarize that too in the email summary that I send out. Yeah, I'll just leave that at that till you get the email. Tony or Chris, any other updates from the Metro region, that high points, low points?
No, most of the conversation was Mr. Sheehan. He basically talked the majority of the time.
Yeah.
Yeah, the agenda pretty much consisted of updates from you and the other
Willie.
CEOs, but you just reiterated your meeting, so.
Yeah, I'll get out the detail of the state's plan. Nick, did you have a question?
No, I was just going to make a comment on the redesign. As I sent it out to everybody a few weeks ago, there was a large meeting of advocacy groups and the board association. Both Alan Bolton and Bob Shin were present. think it was the 7th of January, the beginning of January, and they came up with a series of principles that I sent everybody the first draft. They've been modified slightly by a smaller committee that basically cleaned up the language and rearranged a couple of them. And they're looking at anybody who wants to sign off. I've signed off personally as an individual, but a number of associations have signed off. I don't know if the Board Association has or not yet, but many of the major disability rights organization, the Mental Health Association, the ARC of Michigan, I don't have the list in front of me, the social workers, et cetera, a whole group have sent it. The major change in that list was we reversed the first 2 points, because the first point was somewhat critical about the issue of financial integration in the SIPs, and the second point had the alternative, so we put the alternative first, basically. And what that organization, it may have actually gotten to the administration now, but what that coalition will send to the legislature and to the administration will be a series of principles for any redesign, the first of which will be to insist that we integrate at the service delivery level before we do the financial integration, and allow that to lead to what the proper financial integration would be, since the financial integration is going to be more difficult to do. I'll send around by email the final agreement, and once I've gotten the full list of who the sign-offs were, I think, what's today, the 22nd, so the 21st was when they were finalizing the listing of the groups that had participated in the development, and the individuals had participated and who wanted to be listed. So I should have that for you within the next couple of days, and I'll send that around to all the board members as well. But to summarize it, it was very politely stated, but it was not friendly to the proposal that the governor or the director had presented, for many of the reasons we've already discussed.
Thank you.
And just as a reminder, you received that information because of your work with that, tell me the name of the affiliation,
Yeah.
the town
Well,
hall, the town hall?
The town hall group was, individuals from that group were invited because of their advocacy work. But I'm also on the board of the Mental Health Association in Michigan, which was one of the groups that participated. And as you know, my prior employment with AFSCME had me do a lot of work in the area of mental health, and AFSCME is one of the people that were invited to the January 7th meeting as well. I wasn't there representing AFSCME. Tim was. I wasn't there representing the MISD, the Mental Health Association. Both Mark Reinstein and our new executive director were there representing the organizations, but I was invited as an individual, as was Liz Bauer, who's...
That's fine. I just, yeah. It was because of your past experiences and your knowledge base.
Yeah,
along with your...
I've got a number of camps that deal with mental health that I've been involved through the last 40 years.
Sure. And that's been helpful to us, so thank you.
So Mark, actually what happened was Mark and Don Hoyle, who's the legislative director for the ARC of Michigan, and Bob Sheehan had all talked about trying to create a coalition of advocacy groups and boards to speak with sort of one voice, and hoped that that would have more impact. Mark had come to one of our town hall group meetings, and we agreed and suggested he do it. So the meeting was called by the Mental Health Association in Michigan, which is the leading advocacy group for mentally ill people with mental illness, and the ARC of Michigan, which is the largest developmental disability rights organization, the state MPAS, Protection and Advocacy there were, I think, 11 different organizations that were involved.
Great. Thank you. Dave, you can continue.
Yeah, and excuse me, I just noticed I did include in your packet the funding summary from Bob Sheehan at the association for this current fiscal year. Bob did review this at today's directors forum. They're projecting a annualized $144 to $160 million underfunding to the PHP system statewide. Again, that's based on the information that was shared with us before the fiscal year started. They gave us a lot of really good detail on the Milliman model and how that would look for us and to what's actually happening. The state hasn't responded. They've said just that they'll fix it. Their finance people were not present at the last meeting that the PHPs had with the department, and that resulted in kind of just a high-level overview of kind of we're aware of it and we'll fix it. So we'll track this closely. If there's any questions on that, I'd be happy to respond after the meeting, and I'll do a summary of what this means for Macomb County and get that out in an email as well. And lastly, I'll end on a positive. The group home tour is scheduled for February the 7th. The bus will be leaving from the administration offices at 9 o'clock sharp. If you could try to arrive by 8:45, and we should be back to the office by noon that day. So thank you all very much.
Thank you. Next, we're on to item number 12. Any other agenda items from board members? Tony?
Not an agenda item per se, but there is some sad news I'd like to share with the board. A long-time Citizens Advisory Council member Elaine Palmieri passed away 10 days ago. And she demonstrates the very thing that so many of us parents are nervous about. Going away before the loved one is really firmly planted into a system. Anyway, when I took my oath, I saw me helping somebody find their way, and this is someone I will volunteer for. I'm going to find what the loved one needs and to connect their family members with resources for that. But somebody needs to advise I can advise Lori Valueway because Elaine was also an employee of Creative Empowerment Opportunities. I don't know how that affects their plan. But anyway, that's my sad news.
It's hard to reply to, but thank you for sharing that and for continuing your advocacy. Appreciate that. Anyone else?
I have another update.
Oh, go ahead. You can finish.
Tony's comments reminded me, we had the Citizens Advisory Committee Tuesday of this week, and Cindy Lomasny, who is she is on the Mental Health Authority Task Force, and she's a newer member to our Citizens Advisory Council. Her son passed away recently as well. She made that announcement. She wants to continue, she will continue to advocate and participate. So it was unexpected.
Thank you. Lori?
I just want to say on January 15th, Lori Doyle and I were on a conference call with Bob Sheehan and Alan Walter for the Person Served Advisory Group that Malachi is from Oakland County.
Oh, Malika?
And basically they met right after the legislative with Alan, and probably a lot of the same things you've already heard, where the CMH stands in support of certain bills and what they don't like and see. but I just thought I'd update you on that we are still meeting, and our next one is in April. Is in April, so we were on that, it was like an hour. So, and then really, that's all we got accomplished, was kind of just updating everybody, and it was a very small attendance. That's it.
Thank you. Anyone else? Seeing none, we'll go to item number 13, which is hearing of the public. Is there anyone from the public that would like to address this body?
Hi, I'm Lori Doyle, and I also have some sad news to report. We lost our peer, Arlene Ames, on Christmas Eve, and that was the resolution that you had approved. And her coworkers were such a source of support to her through that ordeal, and it was just all a very touching experience, and but sad. But now I would like to introduce Lori Abraham, and she is a parent support partner for Specialized Children and Family Services. And she has been a parent support partner for 6 years now, and she would like to share her story with you. Thank you.
All right. So, she kind of stole my beginning. So yeah, I've been doing this for 6 years. How I got into this role is I have a son that I adopted. He's been with us for 7 years now, and he has always had mental health issues. He's now 14 years old. So that's how I got my role, is because I understand how it is to parent a child with mental health issues and how stressful it is, all the meetings you have, just, it comes with a lot. So it's very overwhelming, but I get to go and support other parents and, you know, try to give them a little bit of support and understanding and some hope for the future. And sometimes there is nothing that I can give them, like actual hope, but we can at least try to find some different solutions, or there's a lot of problem solving. I feel like some parents need help at base level, and I go in there and they're just so unorganized. I have to help them organize their life so that they can help their child get the best care that they can get. Some parents are very high functioning and they have it. They just need someone to vent to and needs that support. So that's what I do. I only do it part-time because I am so busy. Besides my 14-year-old son that I adopted, we also have a 5-year-old we adopted, and then I have a daughter that's 2, and then we have a 21-year-old son. So we're all over the board, and we're very busy. They've all got their own things that they're into. But I enjoy my job. I've been doing it for 6 years. I think I'm like the third longest now that's been here. And getting out of the house is kind of like to go help other people. That's my relief. That's my away from home. I get to go talk to other people that understand, and I get paid to do it. So it's a very nice role for me, but it's good for the other parents that I go visit as well. Because there's sometimes I feel like I'm not helping them, and then I'll kind of have a meeting with them and say, like, what are our goals? What are we going to work on? And they're just like, I can't believe how much you help. Just having you here to voice all these concerns is so nice for us. So I hope I can continue doing it. And as far as my son, we've been through, I think, every program that there is. Still looking for some solutions. We use little bits and pieces of all these different programs that we've learned through all this. And like I said, still trying to find our way and have a better hope for the future. So that's my story.
Thank you very much, and thank you for being a listening ear, because for me, that's just, can you just listen to me without being critical, and then I feel better, yeah. So thank you very much for your work. Is there anyone else that would like to address this board?
Good evening, everyone. I'm Sean with CO, just to give the monthly report, which I do have copies of for everyone. To start off with, for our individual served update, all programs held holiday dinner parties. This year, everyone received new CO lunch boxes, which I did bring one. The CO also purchased 5 new vans to provide services to the greater community. We are making the change to our current title of skill building instructor to direct support professional. This is a countrywide change that is occurring to help recognize that the services we provide are a profession. We are also making a change from individual served to person served. CEO is currently working on a jail diversion program with the county. This program would allow a first-time nonviolent criminal a chance to become a direct support professional. They would follow the implemented policies in order to avoid sentencing, and they would become an active member of society. Our monthly safety topic for December was work rules and conduct. For our community center update in December, at our Anchorville, Clinton Township, Mount Clemens, and Washington location, in total, they spent over 55% of their services that we provided in the greater community. Over 205 hours of volunteer work was completed, and around 420 meals were delivered through Meals on Wheels. For our stakeholder update, at our Washington location, we'll be hosting a Valentine's bake sale Friday, February 14th, which is on the back of your packet. And CO has also completed the CARF survey. We are pleased to announce that CO's employee retention rate for December was 97%. As Tony mentioned too, thank you for bringing that up, but Elaine did pass away, as he said. She was part of our team for 21 years. I personally did not know her, but to all my bosses, I know she was a real friend to everybody, and as I wrote in there, just a real concrete angel for everybody. She will be dearly missed, and everyone did love her. At the bottom, I was going to have a presentation set up on the laptop tonight. I did not get a hold of. However, it was from our exit survey from our CARF surveyors that came out, basically going on to say that one of the surveyors, Michaela Matlock, had about 2 minutes about just the praise and the feel and of how she feels like everybody's loved, and a warm, welcoming sense that she got coming into our locations. And the administrative surveyor, Darlene Kratz, she has a long, outstanding career in the mental health field. Since she was 16, she's now retired, but does do CARF surveys twice a month. She also prided us on being, if I remember correctly, I think she said one of the most organized and well taken care of locations. That's it for tonight. Thank you again.
Thank you, Sean. Is there anyone else that would like to address this board? Anyone else? Seeing none, we will go to adjournment. A motion to adjourn is in order. Motion by O'Connell, supported by Kraft. All in favor signify by saying aye. Opposed? This meeting is adjourned. Thank you, everyone.